Hello, my name is Katie May Berens, and today I will be presenting on patient satisfaction in the industrial athlete, current status and assessment of the gap. So, a quick review of what we'll be discussing today. I'm going to review what the problem was as a whole that we were trying to address with this quality initiative project. I'm going to give you some background on Dot Foods Incorporated as well as our occupational health team. We'll talk about patient satisfaction in healthcare currently, and then I'm going to go over the baseline assessment, design, and strategy so you can kind of understand what route we went with this quality initiative project. And then I'll go over the results and lessons learned and give you a conclusion of what I found with my project. So what's the problem? There's two main things we're looking at when we're looking at the problem of patient satisfaction data collection as a whole. So under patient satisfaction, there's four bullets there, and they're all separate points, but really they coexist when you're looking at the problem as a whole. There is no standard of practice in the occupational setting for data collection concerning patient satisfaction. And partially that's because there is no patient satisfaction tool that is specific to the occupational setting. Therefore, data is very limited, and therefore none of this is standard in this setting as a whole, nor at Dot Foods Incorporated, which is my clinical location. Because of this lack of standards in terms of patient satisfaction data collection, there are huge missed opportunities. This kind of data can give us all kinds of information on how patients feel about their healthcare provider. It would allow them to rate us. We're missing data in terms of how patients feel about their access to care and the communication they have, not only with their providers, but between their providers. We're missing that data on how they feel their care is coordinated, and we're missing the data in terms of how they feel things are progressed in terms of timeliness and effectiveness of the care that they receive. These are all big data points that we're missing because of the lack of standard in patient satisfaction collection. So, to give you some quick background on Dot Foods Occupational Health Services, Dot opened up in 1960, but we didn't have an occupational health team until 2008. And really, in 2008, that health team consisted of a registered nurse and then a wellness trainer. Since then, we've expanded quite a bit, not only in staff size, but in services provided. We now currently staff 2 registered nurses, 3 full-time athletic trainers, an occupational health assistant, and have just recently developed our relationship with Western Illinois University, and we have one of their graduate assistant students doing her clinical hours with us in the evenings, which has been wonderful. In terms of service expansion, we now provide rehab on site. We do a lot of preventative work in terms of FMS screening. We have a shoulder prevention program. We have an ankle injury prevention program. And when I first started in 2013, we didn't even have an office. So the expansions have been great in the last 9 years, but quantity doesn't necessarily guarantee quality. So that was one of the main reasons I decided to pursue this topic for my ARP project. Some data collection that DOT really excels at is injury frequency and injury severity collection. And a lot of that is because, first off, it's an OSHA requirement. And second, it's a lot easier to track. It's just a bunch of numbers. And then something the occupational health team tracks is our patient contact numbers. We've been doing this in depth since 2016. We had a rough idea in 14 and 15, but 2016 has really excelled for us in terms of data collection. We know how many people we see every year. We know what those consult numbers look like. So we could break down rehab services versus injury evaluation, versus following up with a new employee. So we do a really good job of collecting a lot of the objective data, but we don't do a great job of looking at subjective information. And that's where patient perspective and satisfaction with care would come into play. Based off of this research project, this quality initiative project, it will be a goal for us for the next several years. If we're looking at patient satisfaction as a whole in healthcare, there really is no true standard across the board. Hospitals have established some standardized data collection processes. They utilize the Hospital Consumer Assessment of Healthcare Providers and Systems Survey, or the HCAHPS is what I'm going to refer to it as. And this is really just a document that's asking how do they feel their experience was at the hospital. It looks at the whole experience, because really, if you're looking at patient satisfaction, it entails a lot of things. It entails their relationship with the provider, how they felt the minute they walked in the door, how they felt their care went the entire time they were going through this experience, then how they felt things were resolved and followed up with. So it looks at experience as a whole. This is required if hospitals want to receive government funding, so therefore most hospitals have adapted to this standardized data collection. In terms of other healthcare professions, there are no standards. Occupational therapy, physical therapy, and athletic training don't have a whole lot out there in terms of patient satisfaction data collection. And some of that is because there aren't a lot of standardized tools for each specific type of domain. But as of right now, nobody's doing a great job of this. Currently, the NATA is making a big push towards patient-centered care approach, and that's a big change in healthcare as a whole. But patient satisfaction data collection is one part of that patient-centered care approach. So one way we can look at it as athletic trainers is it's a form of benchmarking for our profession. It allows us to get some objective data on subjective conversation and compare ourselves to other professions within healthcare. So that's one big thing that the NATA is pushing in terms of patient-centered care approach. Another aspect for those ATs that are really interested in reimbursement, patient satisfaction data is evaluated, and then reimbursement decisions are made based off of that data. So it is an important piece of the patient-centered care approach, and it's an important piece of getting ATs um, on the scale in terms of where we rank with other healthcare professions. So one of the baseline assessments we did for this project to get a good idea of where this data collection could occur is a process diagram. This diagram that you're looking at gives you a breakdown of what your typical injury process looks like at Dot Foods Incorporated. To give a real brief summary, people will walk in my door. I will be with them basically through the entire treatment, the entire injury process. And that could be a week, that could be 3 months. It just depends, obviously, on the severity of the injury, what type of injury, what type of care they require. So that's what all the little paths throughout the main piece of this process diagram illustrate. So when looking at when would be a good time to start to incorporate patient satisfaction data, really to start, the best place to do that is at the end because there is so much variability in an injury and in managing each individual case that for the time being and for this quality initiative project, we felt it was the best to incorporate it at the end. So you can see in the green box in the diagram piece to the right, you can see where it was incorporated to the end of the process. The second piece of the baseline assessment was really looking at what kind of barriers we might face with this implementation. So we did a standard fishbone diagram to kind of lay out what the main problem is at the head. So no current process for measuring patient satisfaction with Dot Foods Occupational Health Team and Services. That's our main problem that we're trying to address. And the four main categories that really create the biggest barriers would be people, procedures, measurements, and environment. So in terms of people, there's two different things really that create the barrier of people. The first is our occupational health team truly has a lack of experience with patient-rated outcome measures. So that itself is a pretty big barrier because that's a lot of education, not necessarily hard education, but a lot of education to do. And when you look at the size of our staff mixed with the high workload that we have, there could be some pushback. Another piece so the people category is that we have a very unique patient population. So we have a variety of ages, we have a variety of cultures and genders, and it's a very unique work environment just in general. So finding the right tool for that population was definitely a challenge. If we're looking underneath procedures, the biggest barrier under the procedures category would be going through the process of getting upper management to approve everything. We're like any large corporation, there's a whole bunch of people that rank above me, so we have to get their approval before we can make any changes that could affect production time and people's time out on the floor. Another aspect of procedures is there's no patient satisfaction tool currently utilized, and there's no standard of practice for patient satisfaction data collection or documentation of that data. So those procedures will need to be created if this becomes standard practice at Dot Foods. In terms of measurement, the biggest thing is that there's no outcome measures concerning patient satisfaction that have been designed specifically for the occupational setting or for industrial athletes, if that's how you want to look at it. So trying to find the right tool that is currently utilized for a population that is very unique is the big barrier. And then in terms of environment, there's two subsections under this category, but really it all comes down to time is money is a big mentality at DOT. So from a management standpoint, they're going to be looking at how long would I be taking somebody off the floor? What does this result in terms of production time? What is it costing DOT to be doing this? And in terms of a patient or an employee standpoint, they already know that time is money is a big mentality. So do they even want to take the time to do this if their leadership doesn't care about them as an individual? So that's a large barrier to face as well. In terms of design, really I looked at the three questions posed by the model for improvement. So what are we trying to accomplish? How will we know change is an improvement? And what change can we make that will result in improvement? So what we're trying to accomplish is implementation of using some form of patient-rated satisfaction tool with our patients as we resolve care. We will know that change is an improvement by measuring if it's administered to those patients as well as what the completion rate is. And we will know that change has resulted in improvement by actually administering the survey and making it a part of occupational health team standard work. So for the short-term strategy, which was the main piece of this quality initiative project, I administered PDSA Cycle 2, which was survey administration in the dry goods warehouse with day shift employees. So the plan was to administer this survey, the CAPS clinician and group survey, to all dry goods day shift employees who have injuries that resolve between August and September of 2017. This did occur between August and September of this year. We reviewed all the results, which I will discuss a little later on in the presentation. And then based off of these results, we're going to be hopefully starting to look into PDSA Cycle 2 to administer the survey in all locations. Long-term strategy. So for PDSA Cycle 2 specifically, we would be looking at repeating PDSA Cycle 1, but in all day shift warehouse locations. So it would include the dry goods warehouse, the frozen goods warehouse, and the cooler goods warehouse. And all employees that are resolving their care with us would be given the option to complete this survey. For PDSA Cycle 3, it would be repeating the same process, but we would be administering this survey to all warehouse locations. So that's a big population jump. So PDSA Cycle 1 and 2 are very important to this process because we need to understand how it's going, how if people are interested, what the administration and completion rates look like. So when we get to the entire warehouse population, we have a pretty fluid way to go about this. Because this looks like about 1,100 people versus on day shift, it's only around 450 people. So it's important to have the process worked out before we get to PDSA Cycle 3. For PDSA Cycle 4, it would be administration to all patients in all locations. So that would include our distribution centers. We have 9 across the country, ranging from California to Maryland. So as we would also be wanting to include any of the drivers that we provide care to, office staff, garage staff. We have a pallet repair staff, sanitation, housekeeping. We do a little bit of work with all of these different domains within the business. So by PDSA Cycle 4, our goal would be to be able to administer this at the end of all injury consults with all employees. The results for PDSA Cycle 1 were, as you can see, 21 individuals I had 21 individuals resolve their care with me in the time frame of August through September. Of those 21, 18 of those people received the opportunity to complete the survey. Of those 18, 17 actually completed the entire survey. So survey administration occurred to 85.7% of the population that I was resolving care with, and 94.4% of that population agreed to complete the survey. If we're looking at the results that we found within our data compared to the national database of the survey that we used, looking specifically at 2016, you can see that there are 5 different composite groups that we can compare to. So the first one would be access to care. If you're looking at the CAP survey national database data versus the Dot Foods data, you can see that we ranked really well in terms of access to care. Provider communication, we were dead even with the 2016 national database data, which is wonderful. Our office staff and care coordination composite scores were lower than the national database scoring, and I'll go into that in a little bit. And then in terms of rating the provider, we had a really good rating, I think, for an initial administration of this survey. So very happy with the overall results, and very excited to see what we can improve upon based off of these results as well. This table here just kind of breaks things down within each composite score and then the items that were ranked underneath that composite score. All of the individual items really follow the trend that we saw with the overall composite scoring. Our patients are happy with the timeliness of their appointments, they're happy with the timeliness of the care, and they're happy with the way we communicate information. They're also very happy with how providers communicate with patients, and they overall are happy with the providers that they are seeing. But we see that there is definitely room for improvement with our office staff being courteous, helpful, and respectful, as well as using the information to coordinate patient care as a whole. So some lessons learned from this project. It's been a year in the making, so there's a lot of lessons to learn. But in summary, the big takeaways were the patients in the sample population were very eager to participate, and there's a couple reasons that could be. I think one of the main reasons is they've never had their opinion asked, so they were excited to be able to give feedback in an anonymous way that doesn't tie back to them at all, but to give honest feedback to to us and to be able to hopefully make some positive changes based off of that feedback. And I think another reason why this patient population was so eager was because I have a pretty established relationship with the group that I was working with. I've been working for DOT for 4.5 years. So most of the people on this day shift know me, they know my family, they know my husband, we know a lot about each other as individuals, not just as employees that work at Dot Food. So I think that trust that is established made them even more willing and excited to to participate and fill out the survey. Overall, the initial data collected was pretty positive. Like, as you could see in the previous slide, our overall provider rating was very high, which I think goes back to consistency. They've had a consistent person that they see for the last 4.5 years. So I think that's a big piece of that. Timely appointments, care, and information was another higher ranking composite score. And I think a lot of that is because they are day shift employees. The care and the information is really easy to manage with day shift because doctors work day shift hours and doctors are more available between 8 and 5. I think we would see very different results with night shift. Provider communication with patients was also a very high ranking category, and I think that once again goes back to we have an established relationship with this population. The initial data that showed room for improvement, as we discussed earlier, use of information to coordinate care, and then helpful, courteous, and respectful office staff. So to address use of information first, if it's a work comp related injury, a workman's compensation injury, we typically try conservative treatment for 2 to 3 weeks. And for some individuals, that is not fast enough. They want to be seen right away. They want to know exactly what's going on, and they want a doctor to see them. And for some people, 2 to 3 weeks is a perfect time frame. They're okay with it, and there's no issues. But I think something that we can improve upon based off these initial results and discussion with some of my coworkers is making it clearer from the beginning that this is the typical time frame. And if they're not comfortable with that, then we address it from the beginning. We don't wait until at the end of the injury management to find that out through a survey. It's something that we can be a little more proactive about as a team. And that's a change we can go ahead and make right now. That's not something we need more data to figure out. That's an easy thing to fix. Another thing, if we're looking at helpful, courteous, and respectful office staff, we don't really have a dedicated office staff. We have one occupational health assistant, but he doesn't do all the scheduling. He doesn't meet all our patients. It really just kind of depends on the scenario. There's situations where I will be helping schedule the appointment, or our registered nurse will deal with that patient the entire time frame. So, in terms of trying to address that issue, it could be a little trickier since we don't have dedicated staff. But if we continue to use this survey in future PDSA cycles, I could see encouraging them to answer truthfully, regardless of who they're thinking of as office staff, because we all work as office staff in the capacity of scheduling appointments, getting them the information they need, and helping them with it, whatever questions they have. Some limitations to this quality initiative project would be, I don't feel it's a true reflection of the entire population. And a lot of that is because it was such a small sample size. I only had the opportunity to administer this to 21 people, and really only 18 were exposed to it. 18 people is only 7.2% of the dry goods warehouse population on day shift. So it's not a good reflection of day shift as a whole, and it definitely isn't a good reflection of the entire warehouse population because, as somewhat touched on earlier, day shift and night shift will have very different barriers. Then another limitation is this tool is not perfect for the occupational setting. There's a couple questions within the survey that are really designed for more of a hospital or clinic setting. So for now, this is a good tool to get things started, but in the future, if another tool is developed that is more appropriate for the occupational setting, we may pursue that. So in conclusion, the goal of this project was to just get survey administration to be more standard. So in terms of survey administration and compliance, we're very happy with the overall results. As I said earlier, about 85% of the employees were willing to fill this out, and 94.4% of those employees were happy to complete the survey. So we've got a good start in terms of getting it out there that we value their opinion, but we still have a long ways to go in terms of targeting more of the population. As I touched on earlier, the data provides just a small insight into patient satisfaction. We only have 7.2% of the warehouse surveyed at this time. Hopefully we never have 100% because that means everybody's been entered, but it would be nice to get a much higher percentage of the population's opinion on the care that they are receiving. Because for the most part, we've worked with most of the employees within our warehouse at some point in time. We've interacted with them at some point in time. So it would be nicer throughout multiple PDSA cycles to get a higher population surveyed. For future expansion, we plan to look at PDSA cycles 2 through 4 and start to develop that and continue to expand upon that. We have a very focused occupational health team. Our goal is to continue to improve upon what we already do well and to start to include more services. And part of that is understanding what our patients value. And we will need to continue to pursue patient satisfaction data in terms to do that. So thank you for listening to my presentation. I have a huge thank you to Dr. Schneider-Valier. She was an absolutely amazing resource throughout this entire process, and I definitely couldn't have done it without her. So thank you, Allison, for all your help this year.